Hey everyone, welcome to another episode of Ask Dr. J. And just a couple days ago, I had a patient ask me how long it would be from the time they got their implants to when they would get their teeth. Kind of going through a consult. There's a lot of information out there that people read, teeth today, teeth tomorrow, takes 12 months, takes 6 months. So what's the answer? Well, this is not a one-size-fits-all answer. There's many ways and many time factors here. All right, let's dive in. There are many variables that go into how long it takes for you to get your tooth from the time that you start the case or have the implant placed, but we'll talk about two main ones and some things that go underneath these two categories. First, let's talk about patient factors. What do I mean by this? Well, where is the implant going in the mouth? Is it the top jaw, the bottom jaw? What is the quality of the bone? Is it dense? Is it soft like balsa wood or styrofoam? And what is the amount of bone that's there? Do we need to grow bone through a process called guided bone regeneration? Something that we do all the time, but it's a factor that lengthens the time. If there's not enough bone to even place the implant, we have to do that, and it may be anywhere from 4 months to even 9-10 months before the bone graft is ready to place the implant, and maybe another 4 months. So you could be looking in from anywhere in that year range from the time of start to when you get your tooth. So again, a lot goes on, and there's a lot of specific factors that are within the mouth. The second part of the patient factors is what is the overall health of the patient and medical condition. So if you're somebody that's dealing with conditions such as diabetes, we want to know, what is your blood sugar? Is it where it's supposed to be, measured through hemoglobin A1C? Is that stable? Because if not, maybe you started off with good blood sugar and it's not stable. We're going to have to monitor that closely, and that may delay the process of getting your tooth. Or maybe you have an autoimmune disease. If you're a smoker and you haven't been able to reduce the amount of cigarettes or nicotine, or maybe you did and then you went back to it after, we see that sometimes. We really monitor closely, and I will always err on the side of delaying and going a little bit longer for better healing, for better results and better success. So that's the first category, patient factors, a lot involved with that. The second category is, what are we going to do with the implant? What's going on? What does that mean? Well, there's a lot of different indications or reasons that we place implants. Ultimately, it's to replace teeth, but let's talk about different styles. So if you're getting a single implant in the back of the mouth on a chewing tooth, almost always it's something where we have to place the implant goes in and we get stability. That's how it goes in to heal, but we still have to wait about 3-4 months for the bone to basically grow around the implant, hug it, and that's what we call osseointegration or biologic stability, or the implant is part of you now. So on back teeth that are chewing teeth, there's a time period that requires waiting. Sometimes if there's a front tooth that we're placing an implant, we can put a temporary on it, so you'll have a tooth at least and you can smile, but that's what that tooth is for. It's a grinning or smiling tooth, not to be used for chewing. So, because that still has to go through that same process of the bone healing and hugging the implant, but it's in the front, there's a lot less force up there, and that does require definitely compliance and paying attention to what you're eating as a patient. So what about all this information about teeth in a day, teeth next day? Yes, we do that here as well, but it's for a different style or a different procedure. When someone is getting their entire row of teeth replaced, upper jaw, upper teeth, lower jaw, lower teeth, now we're placing multiple implants and we're connecting them together. So when you have at least 4 implants or more, and they all have a certain amount of tightness that they go into the bone with, and they're connected, because of that connection, we can put the teeth on that day. And that's where you hear a lot of this information. It's a great process if you're somebody that needs this done to get your teeth the next day. It does require soft diet, really, really important. What does a soft diet mean as in terms of when you get your whole row of teeth the next day? If you can take food, if you can smush it between these 2 fingers or cut it with a plastic fork, it's safe. But you're not going to want to be eating on ribs, chicken, steak, those things. It's going to have to wait the 4 months. So as you can see, there's a lot of different things that we use implants for, different ways. There's a lot of different answers to the question. So when it comes to proper dental care, especially as it pertains to implants, time is not your enemy. It's really important that the proper amount of time is spent depending on what procedure you're getting and who the patient is. Like my patient that came in, she's going to get her teeth that day or the next day because she's getting a full row replaced and she meets the criteria. If you're getting a back tooth, you may have to wait. It just depends. Again, it's who the patient is and what's being done. And I personally never will do more invasive treatment so that you can have a faster result. Again, I never will do more invasive treatment so that we can expedite the process. I'm going to give you the right amount of time for the right result every single time. Thank you for tuning in to another episode of Ask Dr. J.